opportunity for someone who enters into an exchange in the future under this bill would be that there be a public option included as one of the choices.
Mary Bryant?
Who's that?
Mary Bryant?
It's about the healthcare cooperatives. I was wondering if you could talk about that and if it's in conjunction with the public option or if it would be instead of. I'd like to hear a little more about it.
Well, here's the problem. See, the question is about healthcare cooperatives. I have some sense of what cooperatives do in the field of agriculture. I have some sense of what cooperatives do in other fields. I don't know for sure what it's going to do in terms of healthcare. This is an idea that recently has been thrown out in lieu of a public option. Okay, or some are trying to say that it's going to be a different kind of public option. Right now, I don't have a good answer for you because I'm not sure what it is they're talking about exactly. This is part of what I'm going to be trying to do this month. If you have some thoughts about it, I'd like to hear. You know, Kent Conrad from North Dakota, a number of folks are throwing this idea out in lieu of, in place of a public option. I think to try to get more support for the bill as a whole. But I think we don't have enough information right now. I mean, there are some examples that we know about in Washington State and Minnesota where there have been some relatively successful cooperatives in healthcare that have worked. But my question would be, I'd have a number of questions that would be, you know, how can we apply that on a larger, broader basis so that we could really get the effects and the benefits that people say cooperatives are going to bring. I have a big concern in terms of, you know, whether we could have a cooperative that would be big enough to provide the kind of fuel that we would need to realize the benefits they're talking about. Because obviously when it comes to insurance, numbers matter and the size of the pool matter. So I'm obviously uncertain at this point because I haven't seen myself that much as far as specific proposals are concerned, but that's something I'm going to be looking to further. Obviously, keep in mind, again, the process here, folks. This bill is one bill that we passed out of 3 committees with some amendments in each committee in the House of Representatives. The Health Committee, Health, Employment, Labor, Pensions Committee, on which Senator Hartman serves in the Senate, passed out its bill, which is similar to this bill, but different in some ways. The Senate Finance Committee, and that's where they're talking about co-ops as much as anywhere else, because they haven't done a bill yet. And Senator Grassley serves on that committee. We don't know when they're going to be reporting out the bill. We don't have any idea. If we could. I'm trying to. Neither side. No, anyway. And so we're waiting to see what comes out of that committee as well. And then keep in mind again, whatever happens in the Senate, let's assume there's a bill and it comes out of the Senate Finance Committee and the Health Committee and the Finance Committee and Senator Reid, they got to figure out the differences, right? Right now, we have these 3 committees working on this bill. Right now, there's a melding of sorts of those 3 bills happening in Washington at the moment. The chairs of the committee, leadership, that sort of thing, certain members of the committee. We'll get some bill that will go to the floor of the House. Let's assume for a moment that it passes, okay, and that something passes in the Senate. Those might be 2 very grand assumptions to make, given what's happening now. I don't know. And then there will have to be a conference committee. And those 2 bills, the differences will have to be worked out between those 2 bills, and then back to both houses. So we don't know, what's going to happen with the Gulf. I know it's very confusing. The process is confusing, folks. That's democracy, right? Okay. In America, with the more comments.
Is there an Alexander Holly?
Alexander.
You're talking about the public option, you're a supporter of that, and I appreciate you being a supporter of the public option. But on the other hand, will the public option actually cover the 47 million people who aren't covered in the health insurance plan right now? And there's also a lot of concern about cost in that plan. So how would you be able to do both of those things, control the cost and still cover those 47 million people?
Right. Okay, thank you. Okay, first things first, 47 million, whatever that number may be. Those who have no insurance right now. Keep in mind, none of those are illegal immigrants or undocumented workers. They will not be covered according to the Now, again, whether you agree with that or disagree with that or whatever, that's just a fact. Now, as far as the public option, the Congressional Budget Office, which, by the way, is making estimates that are favorable to this bill, and it is making estimates that are unfavorable to this bill. Keep that in mind. Washington, D.C. is very hard to be nonpartisan or bipartisan, right? But the CBO is about as good as it gets in terms of being nonpartisan in their estimation. They estimate this bill will go into effect by 2013. They estimate that by 2019, there will be no more than 4% of Americans on the public plan. That's what the CBO estimates. That's 12 million people, okay? That's what they estimate. Because the fact of the matter is, that's going to be one, as I said, of several options, all right, for folks when you enter that marketplace or that exchange. You get to choose. Nobody chooses it for you. You get to make the choice. You can compare the public option with the private insurance plans. You get to make that choice. Up front, taxpayer dollars will pay for the initiation, the startup of the public options. That's how it's going to start. How will it continue on into the future? It's going to play by the same rules as the private insurance companies. It's going to be paid for by premiums. It's going to be paid for the same way private insurance companies pay, or individuals pay for their, or the private insurance plans are paid for in that sense. It's going to be through premiums. It's going to be self-generating in that sense. That's how it's going to be paid for in the future. Okay, next one.
Okay, Senator, I think that you've already addressed the comments that I had, which were personal responsibility and wellness programs, preventive measures.
Okay, thank you, Jen. And by the way, Janice, a minor correction, I'm only a congressman, I'm not your senator. I have no intention of running for the Senate, all right? Let's clear that up. All right, who's next?
First, I have a statement I'd like to read to, and then I'll ask my question.
Thank you, Randall.
This is a quote from President Barack Obama. Those that I associate myself, who have shaped my ideas, will be those that I will be surrounding myself in the White House. Unquote. On January of 2009 of this year, this is a quote from Government Health Care Advisor Dr. Ezekiel Emanuel. When implemented, the Complete Lives System produces a priority curve on which individuals aged roughly 15 and 40 years old get the most chance, whereas the youngest and oldest people get chances that are attenuated. For those of you that don't know what attenuated means, it means to be reduced, to be forced in less intensity, less effect, less quantity. That is one of his health care advisors. That is a quote. Dr. Ezekiel Emanuel also said, services provided to individuals who are irreversible, prevented from being or becoming participating citizens, are basic and should not be guaranteed. So if any of you in here are elderly, have a handicapped family or handicapped yourself, or a mentally ill child or family member, you will not be guaranteed health care according to Dr. Ezekiel Emanuel, Barack Obama's health care advisor.